So diabetes to me means a life-changing diagnosis. It affects several organs. So in terms of the foot, developing neuropathy, developing ulcerations, infections, which may lead to amputations and death.
I've been a type 1 insulin-dependent diabetic for about 35 years. One wound was a precursor to a collapsed foot. There was a 50% chance that I would ultimately have to amputate my foot.
Amputation's always a possibility, and that's always been in the back of my mind. In the case of one foot, the conditions resulted in partial amputations of a couple of toes, so it's very real for me.
On August 14th, I was admitted to the hospital at John Muir because I had a septic foot. I have a history of diabetes and thought that as a physician, I could just take care of it myself. Unfortunately, that didn't work out. For 2 years, I got partial treatment, but my wound never completely closed.
Treating a diabetic foot wound is very complicated. The care is so fragmented that the patient has to go to see a foot doctor. They then have to make an appointment to go see a vascular surgeon, a prosthetist to make their shoes or an insert. And while all of this is being done, a lot of time is wasted. Time is tissue. Every minute that we waste, we may lose a part of the foot.
It was to that end that I asked one of my colleagues, a good friend, who actually worked with Dr. Reiselman, and said, hey, Des, I know one of the best podiatrists that takes care of wound care in the Bay Area. And there began the recovery to my foot being healed completely.
What we advocate and continue to advocate is a multidisciplinary approach to combine the expertise of vascular surgery and podiatric surgery to figure out what is really causing the problem. And many times, the problem is caused by many factors. And if we can address those factors in one setting, then we can save not only time, but ultimately we can prevent the amputation.
Because of the injuries that I've suffered, I've become aware of what a need there is in the community.
There are limited options in the Bay Area for advanced wound care, especially for patients who don't have a lot of resources.
Coming out of my surgical training, I quickly realized we did not have enough resources for these diabetic foot ulcers. So research is absolutely crucial, and that's when I opened Center for Clinical Research to be able to offer patients not only the current available treatments, but the treatments that are potentially going to be available in the next several years.
One of the things that drew me to Dr. Reiselman in the first place, close to 10 years ago, is his extensive experience with wounds and diabetic ulcers and such. And to me, that's been a lifesaver.
So Anna we initially saw in the hospital with a complicated ulcer, and she has been excited to participate in these clinical trials. And she has really responded to the treatments well and hasn't had any hesitations because she trusts us that we're going to do the best for her.
Regular care wasn't working, so I was willing to try. Although they may be risks, there were risks that I was willing to take.
I think it's important to realize how significant diabetic foot ulcer really is. 50% of patients who have a diabetic foot ulcer will die in 5 years.
I'm an attorney by background, and I thought very carefully about Dr. Reiselman's recommendation that I participate in some clinical studies. His reputation and the care that I'd received at UCSF was a large factor. He also explained to me that there were limited risks, if any, in the type of treatment I'd be getting, because I went through probably 5 or 6 different clinical trials, which is a testament, I think, to my satisfaction with the treatment I had here.
Center for Clinical Research has been a huge benefit for some of our patients, many of whom suffer with chronic venous insufficiency because of needle use in the past.
Everything gets taken care of. Whatever supplies that I need, they make sure that I get to my appointments, and they make it very easy to participate.
They're very responsive. It's easy to reach staff at Center for Clinical Research. Great follow-up with me by keeping in touch and telling me about the patient's progress, how they're doing in their wound care, whether or not they're making their appointments, when they stopped, whether they qualify for treatment or not pretty quickly.
One of the wonderful things about participating in trials through the Center for Clinical Research is there's no cost.
There is no cost to patients for treatment at CCR, which is really wonderful. Another huge benefit for them is that some qualify for a stipend, which is a substantial sum for a lot of our patients.
Dr. Reiselman has been blessed to help the community through clinical research so that people don't have access, now have access to care. The care I received was so excellent, without a doubt, seeing anybody that has any type of foot complaint problem, that I would definitely refer patients to Dr. Reiselman.
I would absolutely recommend other providers, especially in the safety net healthcare system, refer to CCR. Our patients have been really happy with the care they've received, and wounds have improved.
My experience here was absolutely superb, and there's a real need for this in the community. I've been told by several doctors that had I not received the kind of care that I've had for the last several years, that I probably wouldn't have my foot.
My goal has always been and will continue to be to prevent amputations and allow diabetic patients to keep their limbs.